Welcome, everyone, to this wonderful webinar with Greensboro Plastic Surgery. We are here to announce our brand new treatment, UltraClear. This is our first virtual launch event with Dr. Collier Pace. If you have any interest in laser treatments or in skin rejuvenation, we are going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments, and why we're so excited about this new device. We also have a promotion, so make sure to stay tuned until the end of the webinar and we'll explain how that works. Before we get started, let me introduce you to our wonderful speaker. So I'm pleased to introduce Dr. Collier Pace, who is a board-certified plastic surgeon with the American Board of Plastic Surgery and an active member of the American Society of Plastic Surgeons. With nearly a decade of experience paired with a passion for helping every patient look and feel their best, Dr. Pace treats every patient as an individual and will work closely with you to ensure you are completely satisfied with your results. And now, Dr. Pace, if you'd like to take it away.
Awesome. Thank you. Yeah, well, that's a great intro. And yeah, it should be, hopefully a really informative talk to discuss the UltraClear laser. It can do a broad variety of things and a broad variety of patients. And I think this first, slide is kind of indicative of that. And what you see is patients with a variety of skin types, from lighter to darker. And that is one of the big selling points of this laser is that it can be adapted and used in just about everybody. So the first thing that I will show is a sort of a intro video about the laser that gives some of the highlights. And so there we go.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Awesome. All right. So I think another thing that's important to point out is that it can treat a variety of problems, from uneven tone and texture, pigmentation, fine lines, wrinkles, sun damage, acne scars, surgical scars, and there's not a lot of lasers that can treat all of these things, and all of them can be treated at the same time. And so I'll get into some of the different settings and levels and ways that the laser is applied, to kind of make sense of all that. The comfort to me was another big deal in terms of why I chose this laser above others. Many lasers that have been used in the past are really hard, have been really hard for patients to tolerate without going to surgery. Many of the CO2 lasers, and others require, certainly at the very least, numbing injections, and many of them, are done under anesthesia. And that's not the case with the UltraClear. The UltraClear has been used throughout its spectrum of applications with topical numbing only. Now, occasionally someone might need a nerve block or want a nerve block that can be injected in the office, but you certainly don't need to go to sleep with this laser. And I think a lot of that has to do with how the technology and how the energy is applied, which I'll get into. It's a versatile treatment, it's quick, and a lighter treatment like the 3D Miracle, which is a superficial, kind of similar to a laser peel. That can be done in 15 minutes with no numbing, and I will show myself getting that treatment here in a few minutes. The more in-depth treatments that are deeper in a number of passes, those might be, an hour long in total, but it can be certainly very quick and easy to do if that's the objective. Um, we've touched on this already, but it can be used throughout the spectrum of skin types, and this just goes from type 1, which is you basically can't get a tan, you're very very light, pale in complexion, all the way up to type 6, which is a very very dark complexion, and many of the lasers previously on the market could only be used in lighter skin types. And that was a concern for me in terms of investing in a new piece of equipment. I wanted something that I could use on everybody if possible. And now, granted, with this laser, you don't use it the same way on every patient. There are some things within the settings that you change when you get to a darker skin type in order to increase the safety and avoid problems. But it is very adaptable and can be used on everybody, which is great. Um, you'll you'll see this broken down over the course of the talk, but broadly, I would classify the treatments with the UltraClear laser into three categories. Um, the 3D Miracle is a superficial treatment, right on the top surface of the skin, and that can be helpful for things like pigment, finer, real subtle textural improvements. Tone of the skin can be improved superficially. But if you have things like deeper wrinkles or acne scars, um, in order to treat those, you will need to penetrate deeper into the skin to get the collagen stimulation and so forth needed to smooth out those deeper concerns. And so that's the next level down, which is the ultra, which penetrates down into the deeper layers of the skin. And finally, laser coring is a unique, fairly innovative concept where you are removing essentially small cores of skin, and when the skin heals, it is tighter. And so the skin tightening effects that you will see in the slides that I'll show are many in most circumstances related to the laser coring. And I'll break all that down as we move through. Um, as you go deeper with the settings on the laser, typically the downtime or the healing time also increases. So with a superficial treatment, which is branded as the 3D Miracle treatment, with that you're red for a couple days. Maybe 4 days later you have some sloughing, or peeling of the superficial layer of the skin, but it's a fairly simple, easy process. As you get deeper with the moderate and advanced settings, there's a bit more healing that takes place, and you might be pretty red and swollen for the first, 2 to 4 or 5 days, until things heal and start to calm down. But you can see over here in the last column, the situations where you might use the different settings in a younger person, there's not a lot of reason to do an aggressive treatment on someone that's in their 20s in most cases. But as the degree of aging increases, in order to get the result, it requires more aggressive settings with the laser. But the nice thing is that you can pick, and you can pick which area of the face you do what level of treatment depending on the needs and goals. So it's very nice to be able to have that level of control with this device. Just some kind of history within the laser industry. A lot of these the laser devices started to come around in the 90s, maybe the late 80s. You see CO2 laser resurfacing, which has been around for a long time and has been almost the standard, when it comes to resurfacing for a long time. The erbium YAG technologies came a little bit later, and there's a lot of lasers on the market now, which makes it very confusing both for patients and for surgeons to navigate which device does what and what is going to be the best, device for a given set of circumstances. I will say that, in the patients that I've talked to in my practice, over the last couple years, the CO2 laser can get a very good result. It is effective. The downside, in terms of what patients have reported to me, is the healing time. There's a lot of pain. There is a lot of heat that is applied with the CO2 laser that can be difficult to tolerate awake. And, patients would describe the recovery as something that maybe they wouldn't want to go through again, even if they were happy with the results. And so I think many of the surgeons who have been using the UltraClear laser for the last few years, um, many of them have really liked the fact that it's a treatment that can be done in the office without the need for anesthesia, and the recovery time seems to be quite a bit shorter than for a CO2 laser, even when you use it at some of the more aggressive settings. So it's essentially a modern innovation in laser technology that at least in my opinion, is really promising. Um, so this video shows how the heat can be turned up or down depending on your preference and your indication. The CO2 laser delivers a lot of heat, and heat tends to be the cause or source of what's called post inflammatory hyperpigmentation. So if you were to use a CO2 laser on a darker skinned person, there would be a fairly high risk that the area that you treat gets dark for a while. And that limits its use in darker skinned patients. With the UltraClear, you can deliver heat, which are the red arrows, um, every other pulse or more. And so you have a very fine control over the amount of heat that is delivered. And let's see if we can show that. So the red is the heat, and the blue is the laser ablation of the tissues. And so when you set the coagulation at 1, you get 1 red arrow for every blue arrow. But if you set the coagulation at 3, you get 3 red arrows for every blue arrow. So effectively, it delivers more heat if you want. The advantage of the heat is that it does a little bit more in terms of tightening the skin. And so it can be used to your advantage, but you have to weigh the pros and cons depending on the patient and depending on the needs. A 20-year-old person getting a laser treatment probably doesn't need a lot of heat. So it's nice to be able to do that treatment without the heat in someone who doesn't need it. So here you see those channels healing, and the skin ends up um, smoother, as you see in that video there. Let's see. Oh yeah, here's me. And so this is Anna. Anna's an esthetician in our practice, and she's kind of going through a kind of the steps of a 3D miracle or a superficial laser treatment with the UltraClear. So she's cleaning the skin, and she puts on her laser eye protection. We're always covering the eyes. And there's various ways to protect the eyes during a laser treatment. And that's it. So I didn't have any numbing cream, prior to this treatment, and she's just going across, basically my entire face, delivering pulses of the laser. This little tube down here with the yellow tip on it is a smoke evacuator. So that is on, sometimes with well, all the time with the laser treatments, it generates a little bit of smoke. So that just suctions that out so it can be filtered. And she just makes her way around your face. And so it's really easy to tolerate, can be done very quickly. I think a treatment like this, once you start with the laser, it takes about 15 minutes. Um, so it's quick and easy, and let's see. And that, yeah, at the end. So that's kind of what it looks like at the end, and smiling. So all good. Um, okay, so breaking things down, um, this is the general results that can be seen with the superficial treatment, similar to what I just got. Mostly pigment in this case. I think if you focus in on this spot, hopefully you can see my cursor. But if you focus right here and then look at that same spot on this side, you can see that it's a lot less. The dark spot is a lot more blended in with the surrounding skin 1 month after one treatment. 3D Miracle, same thing that I just got. Similar result in a younger person, and I think in this case, in the after result 1 month later, I would say that her skin just looks a little healthier. It's more uniform in its color, which makes it look clearer. Similar outcome there. 1 month after one treatment. 1 month after one treatment, superficial settings. This is a fairly dramatic difference. And so this patient had what I would describe as sun damage related changes in terms of this pigment. 5 weeks after one treatment, I would say much healthier and uniform in appearance. In the before image, you can see in the creases, the pigment is lighter than in the surrounding skin that had received more sun exposure. Whereas in the after treatment, the wrinkles or creases are kind of the same color as the surrounding skin, which makes them look less prominent. Um, and so now, as we get to a little bit deeper in the next level of treatment, we'll see some different changes. So this is a patient of mine. 1 week after one treatment, we did a superficial pass over her entire face, so the 3D miracle over her entire face, and then did some additional ultra mode, which is the sort of the next level in terms of depth in her under eye area and on her cheeks. So I think this is a pretty nice change at 1 week, and she's coming back to do a couple more, and I would have loved to have shown those pictures, but they haven't happened yet. But I think this is a nice improvement in skin texture and color in a darker skinned patient, which you can't do with many of the lasers that are out there. Acne scarring is a very common concern, and this is 5 days after one treatment. Nice improvement. Another darker skinned patient. And this is another somewhat unusual circumstance for a laser. There's just not a lot of other technologies out there that can achieve this kind of a result with two treatments on. This is essentially a superficial pigmentation, and you can see with one treatment, it's certainly less obvious and almost has a mottled appearance to the pigmentation, and then after another treatment, um, that's a big difference. And so that's a great example of what can be accomplished with the UltraClear. Another example, 10 months after two treatments of pigmentation on the cheek. Similar. And it doesn't have to be used on the face. In fact, many patients will extend the treatment down to the neck or even on the upper part of the chest. The upper part of the chest is a very common area for age spots and sun damage that can be very effectively treated with this laser. And the hands, this is a relatively superficial treatment on the back of the hand, and much more uniform color to the skin, after treating that area. And so in this picture, you can see this is the ultra setting. So deeper level of penetration with the laser. And the target in this case was fine lines around the eye. And I would say the lines in the under eye area and kind of in the crow's feet over here were the focal point. And I think that's a nice improvement. 5 weeks out from one treatment in the office, no surgery or anything like that. Scars, surgical scars, it's indicated for those, and I think over the course of two treatments here, the color and the texture in the after image, it certainly is going to blend more and be less noticeable than the starting point. So in this situation, I think it's a nice way to demonstrate in one treatment that you can treat a number of different components. So I think if you look at her cheek before, and this is 2 months after one treatment, the pigment is a lot more uniform. Okay, so these dark splotches are not as obvious. And also, if you look in this kind of lower, kind of jowl area where the sort of the jawline, it definitely looks smoother after one treatment than at the beginning. And some of these lines on the forehead are less noticeable and smoother afterwards. So one treatment can treat a number of different components of the skin, which is really nice. under eye area 4 weeks after one treatment. Um, in some cases, this might alleviate the interest in surgery. If someone comes in with some of these lines and some skin laxity in the under eye area, they may, be considering surgery as part of their treatment plan. But if it can be accomplished without, then, most people would consider that good news. 1 week after one treatment, several different layers there. So um, again, color and texture obviously better after one treatment. Same thing. Another good example, smoother and more uniform pigment, one treatment. I think this is a really nice example of everything that I've been mentioning. The acne scarring is a very common reason for people to seek laser treatment or some form of resurfacing. And with this, you can get the pigment improvements, which also often accompany acne scarring, and get the pigment improved and the surface irregularities improved all at one time. Um, Example of neck skin tightening with the UltraClear settings. Asian patient who, Asian patients are at risk for hyperpigmentation after lasering, but they do really well with the UltraClear. And this is a pretty dramatic change, I would say. This is two treatments, but if you look at it's obviously the same person, but comparing the before image to 7 days after two treatments, it almost it just looks like a younger version of the same the same person. It's a really impressive result, I would say, with this laser. Scars, I think the real thing to note here is that a child was able to tolerate this treatment in the office. And so, a little bit of numbing cream, and many of the ultra settings are well tolerated, even for someone who, you know, uh, a lot of kids this young, they don't, you know, they like to bounce around a little bit. Similar thing, pigment and texture improvements. Um, I think if you look in this jowl area and down into the neck, much smoother 6 weeks after one treatment. Same thing here, less prominent in terms of the lines on the chin, and the color is improved as well. This is 3 treatments though, so I would say that not everybody gets by with just one treatment. I think it depends to some degree how aggressive you set the laser. The more aggressive, the more change. But it's not always a one and done. Depending on the situation. Laser coring. So I would, this is the setting that I mentioned that I believe has the most, dramatic impact on skin tightening. I see patients all the time who come to me for a facelift who have tried a number of other non-surgical um, attempts to tighten the skin in the lower face and neck, and oftentimes are a little bit disappointed in the impact. Radio frequency microneedling, like the Morpheus, that's an example of one thing that people try, um, and are occasionally disappointed with the outcome. So I think this is a really exciting way to tighten that skin a little bit. It's nowhere near to the same level as as a facelift would be, obviously, but it can be a nice um, bridge, or something to do that doesn't require the commitment of a surgical procedure that that many people are just not able to do. Um, so um, this video shows how laser coring works. It uses the pulses of the laser to ablate small cores in the skin. Um, it's a very predictable pattern. It's very precise. It can be set to a very predictable depth. So you can do it deeper or more superficial depending on where you are and on the face. The skin thickness changes in different areas, and as you ablate those small cores, when the skin heals, it heals tighter. And so that's the concept. Um, and similarly, the laser coring, which is more of a skin tightening setting, can be used at the same time as the 3D Miracle, which I think of as more of a pigment setting, and they can be done and are almost always done together, which is, I think, an important point and a very nice feature of this technology. Um, that is a pretty dramatic result in neck skin tightening after one treatment. Um, there's a lot of people that are just not of the mind to do a facelift that would be happy with that change. Same thing, similar. And the other point that I'll make is even with a facelift, even with a surgical treatment, oftentimes these lines that are around the mouth are are not treated well with surgery. Um, and so each, the surgical or non-surgical indication has its capabilities that, are limited. You can't pull on or tighten these the wrinkles or the skin around the mouth without causing some kind of some odd things. And so the surgical and non-surgical in a case like this would complement each other. Same patient there. Um, let's see. I think, to me, the more dramatic portion of this example is in the lower lids. So tightening in the lower lids, which I think is very clear. And this is just 1 month after one treatment. So these kind of fine lines and wrinkles are, mostly gone. The point to make in this image, I think this is a great result. And so the laser in this case did its job. You can still see some form of under eye bags. And I think, the fat that is around the eye that kind of pooches out, which causes that lower eye bag, cannot be treated with any non-surgical device that I know of. And so, if so that's just another thing to keep in mind, is there are limitations to what you can accomplish, but overall, this is a great result for a non-surgical treatment 1 month later. And that's it. So I think I've gotten to the end, and hopefully didn't run my mouth for too long.
Thank you so much, Dr. Pace. That was fantastic.
Oh
Can
yeah.
I get my treatment?
Yeah.
And So if you go, if you, yeah, right there. And for everyone attending here live, we have a very special promotion just for you. We are offering 20% off UltraClear packages purchased by January 31st for everyone that's attended tonight. And definitely don't wait to book your treatment as the first 5 people to book will receive 20 complimentary units of Botox. So that is super exciting. So don't hesitate to book. And to get started, please call or text the number on the screen, so 336-600-5258 to schedule your UltraClear appointment. Again, thank you so much, Dr. Pace, for that wonderful presentation. I hope you all learned a lot, and please go ahead and enter any questions that you have that you would like to be answered. We do actually have a couple in here now, so I'm just going to go ahead and fire away, Dr. Pace, if you're ready.
Sure.
Um, so a question that we have right now is, what does the aftercare treatment look like?
Yeah. The after treatment experience is going to vary depending on the depth. So that treatment that that Anna did on me in that in that video, I put on some exosomes afterwards, some light moisturizer, but I didn't really alter my routine at all. And so I think with a superficial treatment, it's keeping the skin moisturized and clean, and there's not much to it. When you use the deeper settings, um, usually we will put something like Aquaphor on right away, and so for the first few days, while the initial inflammation is active and Aquaphor vinegar soaks, which is essentially water and vinegar with on gauze that that we put on the face to keep it clean. Basic things like that kind of takes up the first couple days. Um, the As you get beyond that, keeping it clean, keeping it moisturized, those are the real um, 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 things to focus on.
Amazing. And another question that we have, are there any patient financing options available?
Yeah. So in our office we offer care credit and cherry. Both of those can be used. Care credit is more like a credit card that you apply for. Cherry is another option that allows you to kind of make payments over time after the treatment. So both of those are pretty easy to use, and a lot of patients take advantage of those.
Okay, amazing. We have another question. Is this treatment, UltraClear, suitable for someone with rosacea?
Yeah, I think rosacea is a difficult thing to treat for good. There's a lot of things out there for it. We have used it on patients with rosacea. It is indicated for superficial redness and telangiectasias, so that is a indicated use of the laser. Um, I would say that it's probably not going to be, and I don't know of anything that is really a definitive long-term solution. I would say that it will make it better. Um, um, and we've certainly had some positive experience with rosacea patients already. We haven't had the laser that long, but it's probably not a long-term home run fix with rosacea.
Okay. Let's see, we have another question. How many sessions should one, purchase in a package for the second level of the laser, so the ultra clear level? And if more than one session is needed, how far apart should the sessions be?
Yeah, so we've designed our packages to, I think, reflect, what the average number of treatments would be for a particular indication. For example, the for the 3D Miracle, the superficial treatment, we just do the packages in packages of three. Because I just believe it's a superficial, less aggressive treatment. Three is probably a good number to notice a really predictable difference. With the ultra clear level, as you get to the deeper tiers, those are packaged in with two treatments because they're a little bit more aggressive. And I think the majority of people after two treatments are going to be pretty happy. Um, it's not set in stone, as you saw in those images in the presentation. Some people are going to be plenty happy after one treatment. And so it's a very individualized decision. But the ultra clear settings we have packaged in with two treatments, and I would say probably at least 6 weeks in between. Um, around 6 weeks, you have a pretty clear idea of how you did the first time. And I would want to wait at least that long before performing the second treatment because, you want to know, okay, the first time around, we did this treatment at these settings. Do we want to do more? Do we want to do less? And if you give it that whole time to see the final results, you can just have a little bit more information to make the decision on exactly how to do the second one.
Amazing. And we have another question. Can you do the deeper coring laser on darker skin? And do you require a consultation first? And is there a consultation fee?
Yeah, so you can. It would be something to think carefully about, though. The many times in a darker skinned patient, the a lot of the benefits can be achieved with the ultra setting, and you may not need laser coring, or you may at least want to try the ultra setting first before moving on to the laser coring. It can be done, but you have to be careful, more careful in darker skinned patients with the more aggressive settings to avoid some of those post-inflammatory hyperpigmentation or the darkness that can happen um, after the treatment. We currently, essentially require patients to have had some contact with us before we schedule a laser treatment so that we can have some of those discussions. Some patients will make those consults with me. Our estheticians are also really good at looking at someone and having an idea of what settings might address whatever the concerns are. So those would be the two paths. Consult with me or a consult with our estheticians. At the moment, in our office, every patient who requires a deeper setting, um, I am doing that. Anna and Aaron, our estheticians, they they're trained on the whole thing, but as we're incorporating the device into our practice, Anna and Aaron are only doing the superficial 3D Miracle setting. So anybody that needs a deeper treatment, um, I am doing that part of it. Um, that answer it? I think so.
Yeah, amazing. Thank you so much. Well, that's all the questions that we have for today. So thank you everybody for attending and thank you, Dr. Pace.
No,
And
thank you guys. This was a lot of fun. So appreciate your help putting it on.
amazing. Well, we can't wait to see everybody in the office for their treatment. All right. Thank you so much, guys.
Yeah, thank you.